Rotator cuff injury, shoulder condition. Have you experienced some shoulder pain and irritation? First, you need to know the cause before treating that condition. So stay tuned and keep watching this video. Hi everyone, this is boy Lil Z and welcome to another video about shoulder condition. But before anything else, if this is the first time you are watching my video, hit the subscribe button and the bell icon to support my channel. Also give a like, comment, and share this video to everyone at home. And in this video, I want to share with you 5 main points about the shoulder condition, specifically the rotator cuff injury. As we all know, the rotator cuff muscle group is a group of muscles that is very important and that is very famous in your upper limb. It is the muscles that are connected to your scapula and that stabilizes your shoulder during movement. This muscle group is the reason why it is very difficult for your shoulder to be dislocated posteriorly or at the back. However, because of its anatomical position that is tight, this muscle group is easily injured. Number 1. What is rotator cuff injury? You see, as I told you a while ago, your rotator cuff muscle group is very easy to be injured. Rotator cuff injury may be specified into 3 different conditions that may lead to one condition, which is your rotator cuff tear. The causes of these conditions could be due to repetitive overhand movement, forceful and abrupt shoulder movements, and maybe a direct blow or indirect cause due to other conditions. The hallmark sign and symptom of your rotator cuff injury is pain. Number 2. Rotator cuff problems. As I told you a while ago, rotator cuff injury may be specified into 3 different conditions. First is the rotator cuff tendinitis, which is a condition that causes inflammation and pain upon reaching overhand. Second is the shoulder bursitis, which is also called as subacromial bursitis. Bursitis is the inflammation of the bursa, and bursa is the structure that lubricates the rotator cuff tendon. Thus, when there is inflammation, upon movement there may be friction, and there it will lead to rotator cuff tear. And third is the rotator cuff arthropathy, which is the condition wherein there is shoulder arthritis. That means the joint is inflamed, thus leading to rotator cuff tendons to degenerate, and there may be bone-to-bone sensation upon shoulder movement, which is painful at night. Number 3. The diagnosis of rotator cuff injury. You see, merely knowing the signs and symptoms does not lead you to confirm that it is a rotator cuff injury. Again, as I told you before, rotator cuff injury may be specified into 3 different conditions that may lead to one condition, which is your rotator cuff tear. So for your shoulder bursitis and your rotator cuff arthropathy, imaging techniques are very important. Why? Because it may detect if there is inflammation in your shoulder joint or shoulder capsule. However, for your rotator cuff tendinitis and tear, physical therapy special tests are very important in order to specify what tendon or to rule out other conditions that are not related to the rotator cuff tendinitis or tear. But first, let's differentiate the terms tendinitis and tear. When we say tendinitis, there is no tendon rupture, which means the patient can still perform overhand reaching, but there is pain. While tear is when the patient, due to pain, is not capable to raise or perform overhand reaching. So here I will be giving you 3 special tests that may rule out other condition and that may say that your condition is rotator cuff tendinitis or whether your condition is rotator cuff tear. First is the drop arm sign, which is a test used to assess for rotator cuff tear, where the patient is in sitting or standing position while the examiner stands behind the patient and passively abduct the patient's arm to 90 degrees, supporting the elbow. Then the elbow support is released. Then the patient is asked to slowly lower the arm to the side of the patient's body. The test is positive when there is pain while lowering the arm or if there is sudden dropping of arm. The second special test is what we call as the empty can test, which is used to assess the rotator cuff injury where the patient is in sitting or standing position with the arm elevated to 90 degrees, elbow extended, full internal rotation and pronation, which results in a thumbs down position. The examiner then applied downward force to the arm while stabilizing the shoulder and the patient resisting the force. The test is considered positive for rotator cuff tendinitis when there is only pain felt by the patient, and positive for rotator cuff tear when the arm falls suddenly or when there is weakness and pain at the same time. And the third test is the NIRS test, which is done to rule out shoulder impingement, where the patient is also either in sitting or standing position while the examiner stabilizes the patient's scapula with one hand and passively flex the patient's arm while in internal rotation position. The test is considered positive when the patient complains of pain. Number 4. Differential diagnosis. As I told you a while ago, there are some shoulder conditions that may mimic the same sign and symptoms of your rotator cuff tear. So here are 3 conditions that are very closely related to your rotator cuff injury. First is the shoulder impingement, which could be ruled out through special tests, and that its symptoms may include pain upon movement but without tenderness. Second is the frozen shoulder. It could be hard to differentiate frozen shoulder from rotator cuff injury when it is still at the stage 1 because it has the same type of pain. But MRI could solve it, and stiffening could confirm that it is not rotator cuff injury. And third is the shoulder instability, where the same pain are felt. However, the patient's complaint could say it all, because the chief complaint is usually pain and feeling of instability. And number 5. Treatments of rotator cuff injury. Of course, treatments are very important. Physical therapy treatments, surgery, and also medications are very important. For medications, you can give aspirin and also NSAIDs. For surgery, surgery is only needed to conditions like rotator cuff tear. However, rotator cuff tendinitis could be resolved through physical therapy exercise and intervention. Take note that adjunct interventions are very important, such as the application of hot packs or ice packs directly to your shoulder for 10 minutes. This is very useful in order to achieve a good exercise in order to hasten up the recovery. After the adjunct treatments, range of motion exercises are very important, starting with your passive range of motion, going to your active assistive range of motion, going to your active range of motion, then to your assistive range of motion. So here are some strengthening exercises you can perform on your patients with rotator cuff injury. For level 1, we have weight training. You can do internal and external rotations with dumbbells or band, and also shoulder abductions with dumbbells and band, and also your shoulder presses. For level 2, we have low intensity functional training, which is where you can do some throwing and catching activities, pitching, and some light swimming. And level 3 for high intensity functional training, where you can do medicine ball throwing, sprint swimming, and pitching with arm bagging. That's it. I hope you've learned a lot from this video. Again, if this is the first time you're watching my video, hit the subscribe button and the bell icon to support my channel. Also give a like, comment, and share this video to everyone at home. So God bless you all. See you soon on my upcoming videos. This is boy Lil Z. Peace out.
Run.